The following presentation is specific to the North Dakota Public Employees Retirement System, or NDPERS, health insurance. The health insurance is provided by Sanford Health Plan. Eligibility for the health insurance is an employee who is at least 18 years of age and working at least 20 hours a week for 20 or more weeks per year in a position that is permanent and regularly funded, not of limited duration. If the employee is eligible, they may also insure their spouse and any eligible children up until the first of the month following that child's 26th birthday. The focus of this presentation will be the High Deductible Health Plan, or HDHP. The HDHP plan is available to permanent state employees as well as political subdivision employees whose employer has opted to participate only in the HDHP plan. It has a comprehensive deductible and coinsurance, which means individual carrying a family plan is not limited to the individual deductible and coinsurance amounts. One person's services could assume that full family deductible and coinsurance. There are no copayments associated with the high deductible plan. This includes any office visits or prescriptions. The deductible applies first dollar, so first prescription, first doctor's visit, all goes towards the deductible that must be met. The high deductible health plan is considered a non-grandfather plan according to the Affordable Care Act, or ACA, which means more preventive services are covered. The deductible for the high deductible health plan is, as the name states, higher than the Dakota plan. However, it does not differentiate based on the provider you see. If you have a single policy, whether you see a preferred provider or an in-network provider or an out-of-network or basic provider, your deductible is $2,000. A family policy, regardless of in-network or out-of-network provider, your deductible is $4,000. Coinsurance maximums for the high deductible plan vary by level of coverage as well as provider. A preferred provider that is part of the PPO network will have coverage at the 80-20 level. 80% is paid by the carrier, 20% is the responsibility of the member. A single policy has a coinsurance maximum, so the 20% of $1,500. A family plan is capped at $3,000. If you would see a basic or out-of-network provider, your coverage level is at 75-25. 75% paid by the carrier, 25% responsibility of the member. A single policy has a coinsurance maximum, the 25% of $2,000. A family policy coinsurance maximum is $4,000. The total out-of-pocket cost for a high deductible health plan would be the sum of the prior two slides. PPO provider, single policy, $3,500 maximum. PPO provider family policy, $7,000 max. Basic or out-of-network provider, single policy, $4,000 out of pocket. Family basic provider, $8,000 maximum out of pocket. Prescription coverage under the high deductible health plan is based on the type of medication. The formulary medications, which are considered the preferred, are covered at 80% of the allowed charge once you've met your deductible. Non-formulary or non-preferred medications are covered at 50% after the deductible has been met. Prescription medications and non-prescription diabetes supplies are subject to a limit of 100-day supply. The high deductible health plan includes a health savings account. A health savings account is a separate fund that you can contribute to help pay for qualified medical expenses for you, your dependents, and or your spouse. Keep in mind that this is only available to permanent state employees who are enrolled in the high deductible health plan. Also, dependent eligibility for the HSA and ability to claim expenses for dependents is different than the eligibility for dependents to be on the health insurance plan. Not all health savings account or HSA expenses can count towards the HDHP deductible. If you have specific questions about an HSA account, you may contact our HSA provider, Health Equity, for more information. The phone number is available on the slide. Eligibility for the HSA. First, you must be covered by the PERS high deductible health plan to participate. If at any point you stop participating in the HDHP plan, you don't lose the HSA account, but you can no longer contribute to it. Any remaining balance can be spent for any eligible expenses. You are not eligible to participate in the high deductible health plan with the HSA if you are covered by another non-PERS health insurance. If you have a supplemental insurance policy, it would be good to check with your carrier to ensure your policy is compatible with the HSA. You also are not eligible if you or your spouse participate in a traditional medical flex spending account. You are receiving Medicare or TRICARE benefits, or you are a non-resident alien. If any of these would apply, you could still elect the high deductible health plan, but would not be able to take advantage of the health savings account. Before you've met your deductible with the high deductible health plan, you can use your HSA funds to help take care of those expenses. Once you have met your deductible, you now will have insurance coverage as outlined previously and can use your HSA funds for other eligible expenses. Qualified expenses for the HSA include medical, dental, vision, chiropractor, prescriptions, which may include over-the-counter medications with a prescription. For any claims with the HSA, it is recommended and encouraged that you save any receipts should additional documentation be requested by Health Equity. Contributions for the HSA can be done in a couple different ways. First, if you are enrolled in the high deductible health plan with the HSA, there is a monthly employer contribution on your behalf. In addition to the employer contribution monthly, you can also participate in a couple different ways. First, you could pre-tax payroll deduction if your employer allows. If that is something you want to look into, please check with your payroll office. Aside from pre-tax payroll deduction, you could exercise contributions in an after-tax method. After-tax options are setting up automatic withdrawals from your bank directly with Health Equity, or you may send a check to Health Equity to fund your account at any time. Please reach out to your payroll or human resource office, or you may contact NDPERS at the phone number or email provided. More detailed information is available on our website at www.ndpers.nd.gov.